2 pink lines, a rush of excitement. And then you open this door. Suddenly, every bottle and box in here looks like a pop quiz you didn't study for. You are going to experience new aches, pains, and fevers over the next 9 months. But the headache pills you've reached for 100 times before are no longer guaranteed to be harmless. Until now, symptom relief was likely reactive. You got a fever, you took a pill. The goal was simply to make the discomfort go away as fast as possible. Pregnancy requires a shift to a prenatal mindset. You are now playing defense. Every supplement you take or pain reliever you skip is a calculated move to protect fetal development. To navigate this safely, we need to audit the 2 most critical categories of pills for expecting mothers: the mandatory defense of folic acid and the shrinking options for everyday pain relief. The central rule of prenatal medicine is that safety hinges on timing. The risks of any given pill are determined by your exact week on the gestational calendar. Folic acid is your baseline defense. It is a synthetic B vitamin required for the proper development of your baby's brain and spinal cord. This timeline shows the narrow window of early fetal development. The neural tube, which becomes the brain and spine, forms and closes in weeks 3 to 4, often before you even realize you're pregnant. By starting a 400 microgram daily habit at least 1 month before trying to conceive, the risk of serious neural tube defects drops by at least 50 and sometimes up to 70%. This chart shows how your dosage requirements scale over time. You need 400 micrograms early on, bumping to 600 micrograms for months 4 through 9, and settling at 500 micrograms while breastfeeding. Directly, you must audit the label on your specific prenatal multivitamin. Do not assume it hits these marks, as dosages vary significantly between brands. If you have a prior history of a pregnancy with a neural tube defect, your doctor will likely recommend a specialized protocol of 4,000 micrograms a day. Folic acid is a massive statistical payoff, but its efficacy relies entirely on building the habit before the pregnancy even begins. Once you're pregnant, fevers and joint pain will still happen. When they do, the primary doctor-approved option for immediate relief is acetaminophen. However, its safety is conditional. To protect your baby's long-term health, you may have to endure stretches of chronic physical discomfort rather than relying on daily chemical relief. Treat acetaminophen as a surgical tool for acute, sudden pain, never as a daily regimen for chronic discomfort. Common over-the-counter NSAIDs like ibuprofen and naproxen are high-risk interventions that require extreme caution when you are expecting. This schematic shows the risk during the final 3 months of pregnancy. Taking an NSAID can force a critical blood vessel in the fetal heart to close prematurely, pinching shut and causing high blood pressure in the baby's lungs. These drugs can also cause the level of amniotic fluid in the womb to drop, further compromising the pregnancy. If you are managing severe chronic pain and discover you are pregnant while on prescription opioids, the dilemma is even more complex. Do not stop taking prescribed opioids abruptly, cold turkey. Sudden maternal withdrawal creates a shock to the system that can severely harm the pregnancy. However, continued exposure leads to neonatal abstinence syndrome. The baby will go through severe physical withdrawals, breathing problems, and growth issues immediately after birth. High-risk medications demand either total avoidance or a meticulously doctor-supervised tapering protocol. Guesswork is not an option. This scorecard shows your immediate action items. Your next move depends entirely on your current stage. Planners, your task is to start a 400 microgram daily folic acid habit today. First trimester, audit your prenatal vitamin for folate levels and permanently swap NSAIDs for acetaminophen. Second and third trimester, increase your folic acid to 600 micrograms, treat acetaminophen strictly as a short-term acute tool, and consider NSAIDs totally off-limits. Chronic pain managers, your immediate directive is to book a consultation to establish a safe, gradual opioid tapering protocol. Over-the-counter does not mean risk-free. Read the labels, respect the gestational calendar, and always defer to your OBGYN.